Welcome back to the presentation again. The next in our presentation is ischium. This is the lower posterior portion of the pelvis. Joints. We have several joints from our head to toe. These are the points where two bones come together. Kidneys. Kidneys are the organ of the renal system used to filter blood and regulate fluid levels in our body. Larger intestine. This is the muscular tube, which is about 21 feet of length. This helps remove water from waste product which is received from smaller intestine. It also moves anything that is not absorbed by the body towards exertion from the body. Larynx, as you can see on the screen here, this is the voice box. Ligaments. Ligaments are the tissue that connect bone to bone. Liver. This is the largest organ in our body which produces bile to assist in breakdown of fats and in the metabolism of various substances. Lungs. These are the organs where exchange of atmospheric oxygen and carbon dioxide takes place. We have a right lung and a left lung. Right lung has 3 different lobes, whereas the left lung has 2 lobes. Lymphatic system. This is the system which is composed of organs, tissue and vessels that help to maintain the fluid balance of the body and contribute to the body's immune system. Malleolus. This is the protrusion on the side of the ankle. The lateral malleolus at the lower end of the tib is seen on the outer ankle, whereas the medial malleolus at the lower of the tib is seen on the inner ankle. Mandible. This is the lower jawbone, as you can see the red on your screen. Manubrium. Manubrium is the bone which is just above the sternum. This is the sternum. This is where you press when you are giving CPR, and manubrium is just above that. And for a better picture reference, take a look at the red dot here. Maxillate. It's the two-fold fused bone forming the upper jaw. Metacarpals, the yellow one on your screen, are the hand bones. Metatarsal, the green one on the screen, are the foot bones. Muscles, we all have them, and so many of them in our body. These are the tissues that can contract to allow movement of a body part. With muscle, we also have musculoskeletal system, which is a combination of muscles and skeleton, soft tissue and hard tissue, which gives us shape of to the skeletal, support and protect, and allows movement in our body. Nasal bones are the bones of our nose. Nasopharynx. This is crucial to understand in airways. This is the nose, and this is where the nasopharynx, just behind the nasal cavity, is where the nasopharynx opens. And then we have oropharynx going down here. They both meet just below the tongue, converting into laryngopharynx. The nervous system, the system of brain, spinal cord and nerves that governs sensation, movement and thought in our body. We all have orbits. We have 2 orbits. These are the bones around our eye. So this is the orbit. Oropharynx, we just talked about it. It's the oral. It's the airway through the mouth. Ovaries are present in females. This is the egg producing organ. Pancreas, this is a special gland that helps produce insulin and juices that assist in digestion of food. Patella is the kneecap. Pelvis, it is the basin-shaped bony structure which supports the spine and the point of proximal attachment of the lower extremities. Penis, the organ of male reproduction system, which is responsible for sexual intercourse, transfer of sperm. Perfusion is the gas exchange. Remember we talked about hyperperfusion, where the gas exchange is reduced or poor. Perfusion is the adequate amount of gas exchange at the tissue level. Then we have peripheral nervous system, the nervous system which is present in the periphery of our body, in which the nerves enter and leaves the spinal cord and travels between brain and other organs. Peripheral pulses, these are the pulses which are on the periphery of our body. For example, the radial, brachial, posterior tibial, or or the dorsalis pedis, which is on our foot. Phalanges, the toe bone and finger bones. Pharynx, we talked about this. Pharynx. Physiology is the study of body function. Plasma, very important. We have about 55% of plasma in our body, in our blood. This is the fluid portion of the blood. Platelets are components of blood membrane enclosed with fragments of very special cells. Posterior tibial artery, as you can see, posterior, it's at the back in the tibia bone, and it's the artery. Pubis, the medial anterior portion of the pelvis. Pulmonary arteries, there you go. Pulmonary arteries are the ones that carry deoxygenated blood from the right ventricle, deoxygenated blood from the right ventricle to the lungs. Pulmonary vein, on the other side, are the ones that carry oxygen-rich blood from the lungs to the heart, to the left atrium, to this atrium. Radial artery is the artery of the lower arm. The artery is felt when taking pulse at the thumb side of the wrist. Red blood cells are the components of the blood. They carry oxygen to and carbon dioxide away from the cells. Reproductive system, the body system that is responsible for human reproduction, and this is how different it is in the male and female body. Respiration, it is the process of moving oxygen and carbon dioxide between circulating blood and the cell. Respiration system, on the other hand, is the system of nose, mouth, lung, throat, and muscles that brings oxygen into the body and takes away the carbon dioxide. Scapula are the shoulder bones or the shoulder blade. Shock is a very big and interesting topic. It is also known as hyperperfusion. It's basically a damage to one of those three components that make circulatory system. It can be damage to heart or the vessels or blood or loss of blood. Skeleton, as you can see, it's the bones of the body, the structure bone of the body. Skin, we talked about the epidermis, dermis, and hypodermis or subcutaneous layers in our body. Skull, the frontal and side view of the skull, which is the bony structure of the head. Small intestine, it is the muscular tube between the stomach and the large intestine, which is divided into duodenum, the jejunum, which are the beginning and end parts of this. This will receive partially digested food from the stomach, and it helps continue the digestion process and pass the food to the larger intestine. Spleen, It's an organ located in the left upper quadrant of the abdomen that acts as a blood filtration system and a reservoir for reserves of blood. Sternum, this is the breastbone, or this is where those who have gone through CPR training, this is where you press while giving compression during CPR.